In Sub-Saharan Africa, pregnant women hospitalised with COVID-19 are dying at a far greater rate than any other demographic. This was revealed in a new multicentre study across 6 African countries. The findings confirm pregnant women should be prioritised for COVID-19 vaccinations. For more on this, now let's bring in the lead author of the study, Professor Jean Nachega from the University of Pittsburgh School of Public Health, and he joins us all the way from Pittsburgh. Professor, thank you so much for your time this evening. A very important study focused on a population group that is often neglected, unfortunately. Set us up for this conversation. This study focused on 1,300 female patients of childbearing age across the Democratic Republic of the Congo, Ghana, Kenya, Nigeria, South Africa and Uganda. Tell us how you went about the study.
So basically, we were really interested to get some specific data on the African continent, because we on the African continent, as African, we did not have enough data, given our specificity in terms of comorbidity, HIV, TB, malaria, sickle cell anemia prevalent on the continent. We thought that impact on vulnerable population because of those comorbidity are important. So we cannot extrapolate result from United States or from Europe to the continent. That's why we went to conduct this study in this, as you mentioned, special population.
Now, obviously, if you just look at one of those countries being in South Africa, is a country that unfortunately is known for being extremely unequal. And that, of course, filters down into the health care that is available to women in this country. In that sample of 1,300 female patients, were you able to include women who have access to different kinds of health care?
That's correct. So our participants across South Africa represented the majority of our sample, and there was a variety across socioeconomic status of our participants. And again, as I mentioned, this study, whether you look at South Africa, Kenya, Uganda, or Ghana, Nigeria, or DRC, the mortality are quite staggering. As you mentioned, we show that being pregnant was associated with more than doubling the risk of ICU admission, nearly doubling the hazard of death among those women. But what is most important also, we found that among all women, being HIV infected, having a history of prior tuberculosis or having sickle cell anemia was really a risk for ICU admission. So this added really to the importance of this study.
Now, outside of those vulnerable groups within your study group of childbearing age, what could you glean from the behavior of COVID-19 on that sample? What have you learned from it? And then based on that, how will it be able to inform how women in this part of the world are treated for COVID-19?
So basically, it's a bidirectional relationship. So pregnancy impact worsen outcome of COVID. At the same time, also COVID impact outcome for pregnant women. So the implication is basically we need to prioritize COVID vaccination to pregnant women. And this is a big challenge because pregnant women are even more hesitant for COVID vaccination. Vaccine hesitance, it's a global issue, but more so for pregnant women because they are worried about the safety of their baby also. So that's why I think they've been influenced a lot by misinformation on social media of infertility, of prematurity. But all those information, we have a mounting of data that does not confirm. So there is a need for education and a need for really try to get them in through antenatal clinic, community pharmacy, or community campaign vaccination vaccination for this special population to prevent morbidity and mortality.
It's such a good point that you make about information versus misinformation and just education in general. Because I remember when the vaccinations were available for people in my cohort, I was breastfeeding at the time, and I have a sister who was 8 months pregnant at the time. And all we did was ask our doctor, should we get the vaccine? Are we able to, in good conscience, from a health and science perspective? And the doctor said, I've gone through all the information, go ahead. In fact, to my pregnant sister, who was 8 months pregnant at the time, the advice was, go and get it as soon as you can. And I do remember when she did, and she posted about it on social media, she had so many comments from other pregnant women saying, are you sure it's okay? What did your doctor say? And these are people who've got access to information via the internet. What then of women in the same situation but who don't have that kind of access to information? How are we ever going to get over that problem? Because it seems to be the greatest tool in trying to get people who really need to get vaccinated as soon as possible.
You touch on a really great point. That's our next step as research, is what we call implementation science research, to try to see how we can come up with some creative implementation research to try to improve uptake in communities. We are working on that, and hopefully in the next couple of months I will come back to you again to give you our result, because data from South Africa show only 20% of pregnant women are willing to get the COVID vaccine. This was published about a year ago. So we are really far away from really a long way to go.
Prof, a question that perhaps is a bit of a curveball, but just a couple of months ago, there was a big study that came out about the problem of obstetric violence. That's still a big issue in southern Africa. And it really put the spotlight on how pregnant women or women who are in the process of giving birth are not being treated with the respect and the health care that, quite frankly, they deserve and have a human right to. Did any of that rear its head within your study, that in as much as the COVID-19 numbers pertaining to pregnant women were really bad compared to other demographics, how much of that had to do with pregnant women not being given access to the health care that they needed with COVID-19?
Sure, that's another good point you're raising, and which is part of what we call the health system kind of barrier, which include access, affordability, willingness to be accepted, but also all the issue about how to make our service more friendly for pregnant women. So that also a part that need to be worked out in collaboration with the government, national government, which are really very important as a kind of more comprehensive approach of antenatal care, and also to include COVID vaccine is just a piece of the puzzle.
Okay, we're going to leave it there. Thank you so much for your insight and very, very important work.
Thank you so much for having me.
Okay, Professor Jean Nachega from the University of Pittsburgh's School of Public Health, a very, very important study done in conjunction with Stellenbosch University. COVID-19 greatly increasing the risk of complications and death for pregnant women in Sub-Saharan Africa. And they do also point to a very low number of pregnant women that are getting vaccinated. So that's a very, very important note to get out there.